is Alexander Krusina, and I'm a data scientist at the Center for Health Informatics. I have my master's in software engineering, and my work is primarily developing software for various projects at the center. My colleagues and I at the Center for Health Informatics have created a COVID-19 tracker. One of the main goals is to provide as much useful information as possible to policymakers so that they can make the best possible decisions. There's a lot of public data available for COVID-19. However, it's not always in an easy to interpret form, and it can be difficult to compare many different data sources to obtain all of the data. The main purpose of the tracker is to put all of this data in one place and visualize it in a manner which allows for easy interpretation. When you visit the tracker at chi-csm.ca, you're greeted with the question of, how is Canada doing and what should we be doing next? The figures that follow present the available data to the viewer in an easy to understand way. As you go down the page, you can see new cases across the Canadian provinces and for the last 24 hours or the 2-week trend, as well as the total and daily cases for each province, which you can change which province you have selected. As you continue on, you can see cases by health region in each province, or compare all of the provinces directly. We also have data on testing as well as hospitalizations and mortality, which can be seen further down the page. However, one of the key components of this site and the primary focus of this talk is this chart, which allows for comparisons between different countries or regions across the world. The chart shows the cumulative number of cases for each country or region, starting from the day when there were first 10 confirmed cases. This allows for you to compare the trajectories of different countries regardless of when they first reached their outbreak. Additionally, we have implemented policy data for select countries. So by mousing over any of these circles, you can see exactly when specific countries made specific interventions in order to try to reduce the spread of the disease. So because many of these countries are ahead of us on their curves, we can look at this data and try to figure out what policies seem to make the most sense and try to replicate that here in Alberta. So with this data, obviously it needs the right attention. So there have been over 19,000 unique visits to the site, including frequent visits from the Office of the Chief Medical Officer of Health in the City of Calgary. The site has also been shared at the provincial level, in addition to the Calgary Emergency Management Agency and with senior officials at Alberta Health Services. So our position at the Center for Health Informatics is not to advise what decisions should be made, but rather to provide all of the data in a meaningful way and to allow for policymakers to make decisions based on that.